Good afternoon, folks. Today's discussion A is macular degeneration. So we're going to discuss that for today's A. So please join me in today's discussion A, macular degeneration. Okay, here we go. Macular degeneration is an eye disease that affects the macula, the central part of the retina, leading to vision loss, particularly in the center of your field of vision. It is most commonly age-related and can develop gradually over time. Dr. David Malberly, an ophthalmologist, discusses macular degeneration and its symptoms in a video on the page. Symptoms may include blurry vision, difficulty reading fine print, dark or blurry areas in the center of vision, straight lines appearing wavy, and trouble seeing in low light. Okay, two types of dry macular degeneration, which, hold on, progresses slowly, and wet macular degeneration, which can cause more sudden vision loss. Okay, give me a minute, guys. If you suspect you have macular degeneration, it's important to see an eye doctor for proper diagnosis and management options. You can watch the full video here at msn.com, guys. Okay. Discussion here. Macular degeneration treatments depend on whether it is the dry or wet form of the disease. Well, there's no cure. There's no outright cure. Several options can slow progression and manage symptoms. Treatments for dry macular degeneration: lifestyle changes. Eating a diet rich in leafy greens, fish, and antioxidants may help slow progression. Okay. Air supplements, special vitamins containing zinc, copper, and vitamin C. Okay. Vitamin E and beta carotene or lutein and zeaxanthin can support eye health. Complement complement inhibitors. New FDA approved drugs like Syfovin and Lizer very help slow the progression of geographic atrophy, a late stage form of dry eye AMD. Stem cell therapy. Experimental treatments aim to replace damaged retinal cells with healthy ones. Treatments for wet macular degeneration. Anti VG or VEGF injections. Medications like ILA, Lucentins, uh, Va- Vabysmo, and Avastin block abnormal blood vessels growth and leakage. Longer lasting injections. A high dose version of Eylea HD allows patients to go longer between treatments. Then you have gene therapy. Emerging research explores ways to modify genes to prevent vision loss. These treatments offer hope for slowing vision loss and, in some cases, improving sight. If you or someone you know is dealing with macular degeneration, consulting an ophthalmologist is the best step forward. Want to delve deeper into information, guys. Anti VEGF injections are a leading treatment for wet macular degeneration, a condition where abnormal blood vessels grow under the retina and leak fluid, causing vision loss. These injections work by blocking vascular endothelial growth factor, or VEGF, a protein that simulates blood vessel growth. How anti VEGF injections work. Hold on a second, I'll tell you. Give me 1 second to change paper. Okay, VEGF blockade. The medication prevents VEGF from signaling the growth of abnormal blood vessels, slows disease progression by stopping leakage and bleeding. It helps preserve vision, potential vision improvement. Some patients experience better vision after treatment. Common anti-VEGF medications. Lucentis, the FDA approved anti-VEGF drug for wet AMD. Eylea, a longer lasting option, reducing the frequency of injections. Bevoview can last up to 3 months between doses. Vabysmo, a newer treatment that targets two pathways to fight AMD. The injection process. Eye cleaning. The doctor disinfects the eye to prevent infection. Numbing anesthetic drops ensure a painless procedure. Injection. A fine needle delivers the medication into vitus gel of the eye. Recovery. Patients may experience mild discomfort but can resume normal activities soon after. Okay, effectiveness and risks. One minute. Success rate. 1 in 3 patients see vision improvement while 9 in 10 experience stabilization. Okay. Side effects. Possible risks include infection, inflammation, bleeding, or retinal detachment, though these are rare. These injections have revolutionized AMD treatment, helping millions maintain their vision. Want to explore how often they're needed or alternatives? There are several alternatives to anti-VEGF injections for treating wet macular degeneration, offering options for patients who prefer fewer injections or different approaches. Okay, guys, now we're going to go through the different options rather than injections for macular degeneration. Okay, so refillable implant. That's interesting. Okay, let's get into that. Let's see where that is. A tiny implant that continuously delivers lucentis into the eye. Requires only 2 treatments per year instead of monthly injections. Inserted surgically in an outpatient procedure. Okay. Then 2 is gene therapy, a promising long-term treatment that modifies genes to reduce abnormal blood vessel growth. Okay. Could eliminate the need for frequent injections in the future. 3, complement inhibitors. Okay, FDA approved drugs for geographic atrophy, a late stage form of dry AMD. Okay, these drugs target the immune system to slow disease progression. Stem cell therapy. Experimental treatments aim to replace damaged retinal cells with healthy ones. Stem cells may be injected or implanted into retina, into the retina. These alternatives are still evolving and some not yet widely available. If you're considering a different approach, consulting an ophthalmologist can help determine the gene therapy is exciting emerging treatment for macular degeneration, particularly for wet AMD and geographic atrophy, a late stage form of dry AMD. It aims to reduce the need for frequent injections by modifying retinal cells to produce their own therapeutic proteins. Okay. All right. So we're now going to discuss how gene therapy works. Uses of genetically modified virus, often an adeno associated virus or AAV to deliver therapeutic genes into retinal cells. These genes block VEGF, preventing abnormal blood vessel growth in wet AMD. Unlike traditional treatments, one injection may be enough for long-term benefits. Recent advances. Okay. Endocelto implant. FDA approved in March 2025. This surgically implanted device helps preserve sight in people with macular telangiectasia type 2, a rare retinal disease. Okay, OCU 410 gene therapy. Early trials show promising results for geographic atrophy with a 21.4% reduction in lesion growth after 6 months. RGX 314, a potential one-time gene therapy for wet AMD, delivers via subdural injection to neutralize VEGF activity. Benefits and risks. Fewer injections compared to traditional anti-VEGF treatments. Long-lasting effects, potentially years instead of months. Still experimental. More research is needed to confirm long-term safety and effectiveness. Okay, gene therapy could revolutionize AMD treatment, offering long-term vision preservation and fewer medical visits. Want to explore any of these therapies more detail? Best option for you to, for your specific condition. Want to explore any of these in more detail? Okay, guys, I'll be back on for another show soon. Give me a few minutes and I'll be back on with you. For now, Gator Wellness. Take care, folks.